Hello and welcome. Today, we're delving into the world of primary biliary cholangitis, or PBC, a chronic and progressive liver disease. While its primary impact is on the liver, understanding its complexities is crucial for managing its wider effects, including those on the nervous system. The exact cause of PBC remains a mystery, but scientists believe it's an autoimmune disease. This means the body's immune system mistakenly attacks its own cells, in this case, the small bile ducts within the liver. Genetic predisposition, combined with environmental triggers, are thought to play a significant role in initiating this autoimmune response. While we don't know specifically what sparks the disease, research continues to explore various factors such as prior infections, hormonal influences, and environmental exposures. In PBC, the immune system targets and destroys the small bile ducts in the liver. These ducts are responsible for transporting bile, a digestive fluid, away from the liver. As these ducts are damaged, bile backs up within the liver, leading to inflammation and scarring. Over time, this chronic inflammation can progress to cirrhosis, a severe scarring of the liver that impairs its ability to function properly. This liver damage can have widespread effects on the body, including the nervous system due to the build-up of toxins that the liver would normally clear. PBC primarily affects women with a female-to-male ratio of approximately 9:1. It's most commonly diagnosed in middle age, typically between the ages of 30 and 60. While PBC occurs worldwide, its prevalence varies geographically, with higher rates reported in some regions of Northern Europe and North America. It's considered a relatively rare disease, but improved diagnostic methods have led to increased detection rates. The early stages of PBC are often asymptomatic. Many individuals are diagnosed incidentally through routine blood tests. As the disease progresses, symptoms may include fatigue, persistent itching known as pruritus, and dry eyes and mouth. Jaundice, or yellowing of the skin and eyes, can develop as liver function declines. Other possible symptoms include abdominal pain, dark urine, pale stools, and swelling in the legs and feet. Importantly, PBC can also affect the nervous system, causing symptoms like cognitive impairment, peripheral neuropathy as nerve damage, and restless leg syndrome. Diagnosis of PBC typically involves a combination of blood tests and imaging studies. Blood tests can reveal elevated levels of liver enzymes, particularly alkaline phosphatase ALP. A hallmark of PBC is the presence of anti-mitochondrial antibodies, or AMs, in the blood. If blood tests suggest PBC, a liver biopsy may be performed to confirm the diagnosis and assess the extent of liver damage. Imaging studies, such as ultrasound, CT scan, or MRI, can help visualize the liver and bile ducts and rule out other conditions. While PBC doesn't fall into distinct subtypes, disease progression is staged based on the degree of liver damage observed during a liver biopsy. These stages range from mild inflammation to severe cirrhosis. This staging helps determine prognosis and guide treatment decisions. There is currently no cure for PBC, but treatment focuses on slowing disease progression, managing symptoms, and preventing complications. Ursodeoxycholics, or UDCA, is the primary medication used to treat PBC. It helps improve bile flow and reduce liver inflammation. Other medications may be prescribed to manage specific symptoms, such as itching. In advanced cases of liver failure, a liver transplant may be necessary. Lifestyle modifications, such as avoiding alcohol and maintaining a healthy diet, are also important. As PBC is an autoimmune disease with largely unknown causes, there are no specific preventative measures currently. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding excessive alcohol consumption, can generally support liver health. Early detection and treatment are crucial for slowing disease progression and improving outcomes. If you have a family history of autoimmune diseases or experience any symptoms suggestive of PBC, it's important to consult with a healthcare professional. The prognosis for individuals with PBC varies depending on the stage of the disease at diagnosis and the response to treatment. Early diagnosis and treatment with UDCA can significantly slow disease progression and improve long-term outcomes. However, if left untreated, PBC can lead to cirrhosis, liver failure, and other complications. Recent research is focusing on identifying new therapeutic targets and developing more effective treatments for PBC. Studies are also exploring the role of gut microbiome and progression of the disease. Furthermore, researchers are looking at innovative ways to manage complications, including neurological symptoms, associated with advanced liver disease. Continued research efforts offer hope for improving the lives of individuals affected by PBC.